The two largest pharmacy chains in the U.S. will soon start selling the abortion pill.
CVS and Walgreens say the pill will be available here in Chicago and across Illinois. The drug is Mifepristone. It's at the center of legal challenges. The Supreme Court is expected to decide whether to restrict access to it by July.
CBS 2's Tara Molina joins us with more on today's announcement. And Tara, the pill not available just yet.
Not yet, Marie and Jim. I'm told there will be a phased rollout of this pill, and the expectation is it will start being dispensed within the next week. Walgreens and CVS both certified now to dispense Mifepristone, a medical abortion pill, and will start dispensing the drug in states where it's legal. Neither pharmacy would talk to us on camera, instead sharing statements. According to CVS, they'll start filling prescriptions for the medication in Massachusetts and Rhode Island in the weeks ahead. Meanwhile, a spokesperson for Walgreens told me they'll start dispensing in select locations in New York, Pennsylvania, Massachusetts, California, and right here in Illinois. The news follows regulatory changes made by the FDA last year, allowing retail pharmacies to sell the pills. A move praised by President Joe Biden following the restriction of abortion access across parts of the country. According to the Centers for Disease Control and Prevention, medication abortion is the most common method of terminating a pregnancy in the United States, a method approved by the FDA for up to 10 weeks into a pregnancy. Rhianne Hawkins is the Senior Director of Public Policy and Advocacy at Planned Parenthood of Illinois. She told me this is a win for health equity.
Especially to reduce the burdens for people to be able to access this medication and to receive the health care that they need, to be able to go to their neighborhood pharmacy. You know, there's a Walgreens and a CVS virtually on every corner and in almost every town in the state of Illinois. And we're happy that Walgreens and CVS have decided to make a commitment to health equity and have this medication available to patients that need it here in Illinois.
You can find more about this and the regulatory changes that led up to this in the story that's up on our website right now. And we'll be back at 5 o'clock with more. Reporting live in the loop, I'm Tara Molina, CBS 2 News.
See you then, Tara. Thank you.